Welcome to Holmes on Health, the podcast where nutrition, fitness, and hormones meet health span, and science meets real life. I'm Dr. Alan Holmes, a recovering emergency physician turned expert in hormone optimization, metabolic wellness, and living life fully optimized. Each week, we dive into the tools, truths, and evidence-based therapies that help you build a stronger body, sharper mind, and more vibrant life. Whether you're curious, confused, or already optimizing, you're in the right place. Thank you for being here. Let's get into today's episode. Hello, and welcome to this episode of Holmes on Health. I'm Dr. Alan Holmes. Super excited that you're here today. We're going to be diving into a topic that affects millions of women all across the country, all across the world, yet is often misdiagnosed, unrecognized, and many of these women find themselves completely unprepared for it. Today, we're talking about perimenopause. If you're in your 30s or your 40s and you're feeling maybe a little off, lost a little bit of your spark, maybe your sleep isn't great like it used to be, maybe you've lost your patience, getting a little anxious, having a few palpitations, maybe you're fatigued. First thing I want to tell you is you're not alone. There's many women your age that are going through it also. And the second thing I want to tell you, maybe the most important thing I say in this entire episode, you're not crazy. Because you very well might be in perimenopause. You may not know what to look for. You may not know how to handle it. In this episode, my hope is that by the end of it, you feel understood, maybe you understand yourself a little better, and you feel empowered to take next steps that can absolutely improve and change the quality of your life. So here we go. Let's start with the basics. What is perimenopause? It is that transitional phase where a woman goes through before she actually goes into menopause. And during this time, the hormones, the estrogen, the progesterone, they start fluctuating up and down. And then over time, they start declining, and that leads into menopause, meaning where your cycles cease. This is not like a flip of the light switch. This happens over time. The time period is very variable. It could last 1 year, 4 years, 10 years. It can start quite early, a lot earlier than some people would say that it can start. You may go to your doctor and describe some of the symptoms that I mentioned, and they say, well, it can't be perimenopause because you're too young. You're only 33 years old. We know for sure that perimenopausal symptoms in this phase of life, they can start for women quite early, even in their 30s or their 40s. So what's actually going on when this is happening? Well, your ovaries make hormones. And the variability at which they are making the hormones now, the estradiol, the progesterone, starts to vary. Well, this leads to ovulation becoming unpredictable. Your cycles themselves can become unpredictable. You may go 2 months without having a cycle at all. Then you may go a series of months where you're having 2 cycles, or the cycles are very heavy. And this is because of the wildly fluctuating hormone levels. Well, these hormones don't just affect your cycle itself, although it does, but it also affects your mood and your metabolism. It affects how you sleep, how you think. It affects your overall quality of life. So, as I mentioned, a lot of women don't understand what's actually happening to them at this time. Maybe they go to their doctor and explain their symptoms, and they're told it's stress. They're told it must be all the kids at home, and it's a season of life. They're told they're getting older. Or perhaps they're offered an antidepressant or other medication to help with their anxiety. Maybe they're offered some birth control that might help even out their menstrual cycles. What they're oftentimes not offered is a real conversation about their hormones. We want to have that conversation today. So let's get into this. Let's talk about the symptoms. Let's start there. And it can actually be quite variable for women, and not all women have the same symptoms. Yes, we traditionally think about hot flashes and night sweats, and those oftentimes do happen. But oftentimes, long before that's happening, other things are happening. This can be mood swings, and oftentimes it ends up being anxiety. You can be someone that was never an anxious person, always kind of just even kill, and now all of a sudden you're anxious about everything. You're anxious about what's happening with your job, or what's happening in your house, or the anxiety is keeping you up at night because of all the your mind racing all the time. Another thing that happens is brain fog. You just don't think as clearly as you used to. You're having trouble remembering things. You're having trouble accomplishing mental tasks that would have been a breeze for you last year, but now all of a sudden they're not. Your concentration isn't as sharp as it may have used to be. Fatigue is a big one. You're just running out of gas sooner. Your stamina is less than what it used to be. To go along with that, oftentimes perimenopause significantly disrupts sleep. Where you used to get 6-7 hours of straight sleep every night, now you're up every 2 hours. And it's taking you longer and longer to be able to get back to sleep. Maybe the night sweats and the hot flashes are affecting the sleep quality as well. Another big one is weight gain. I hear this story all the time in my clinic where a female comes in and she'll say something to the effect of, I go to the gym 5 days a week. I haven't changed my diet at all. I'm eating the same things. But over the last 9-12 months, I put on 15 pounds and I don't understand why. And I try to exercise more and I try to cut out more calories and the weight won't go anywhere. And it's all right here in my belly. That's such a common story. Well, I'll tell you what's changed for you. It's your hormones that are changing, and that is affecting your metabolism, and therefore it's affecting the scales, how your clothes fit. It's not just you being lazy or you not exercising or washing your diet enough. It's a hormonal problem. Decreased libido is another one. This is not uncommon, and oftentimes it's another one that just seems to be, I don't know why this is happening. I'm happily married. I love my husband. I'm attracted to my husband, but that drive just isn't there. Joint pain is another one. Breast tenderness is another one as well. So the symptoms can actually wildly vary, and it's, again, not the same for... The question would be is, does any of this sound familiar to you that's listening? Like, do you have like your mental checkbox, like, yeah, I've got that, I've got that, I've got that? If that is you, you should be thinking, I think I might have perimenopause. I think I might be. Why are the symptoms happening? What's causing them? Well, it is a fluctuation and eventually drop in hormone levels. Predominantly, this is about progesterone and estrogen. It is also about testosterone, which we'll talk about in a little bit. But these hormones are so important to nearly every system in the body, which is why the symptoms vary so wildly from your brain to your heart to your skin to your bones. So we described what it is, and we described why it's happening. But I know you want to get to the good part, like, well, what do I do about it? Well, the first thing I want to tell you is that, yes, you indeed can do something about it. No woman should have to suffer with the symptoms of perimenopause without them being addressed. And I hope after hearing this, if you are one of these women that just weren't talking about it, you'll understand now you're absolutely not alone, and there is no need to suffer alone through this phase of life. Let's start with hormone therapy. What can hormone therapy do to help you feel better and improve your quality of life during these years of perimenopause? Now, this will be controversial because you may have already had this conversation with your gynecologist or your primary care physician. They said, absolutely not. You can't do hormones because they're dangerous. And I will tell you now that that narrative, that thinking is based on outdated information that's been debunked. Because when I say hormones, I'm talking about bioidentical hormone replacement therapy. And what do I mean by bioidentical hormone replacement therapy? Bioidentical meaning that the molecules in the medications that you would get are molecularly identical to those that are circulating in your body. Now, why is that important? Well, hormones are a messenger. They're a signal. And those signals have to go and interact with receptors that are in your cells. Those receptors know what they're looking for. And so if you give those receptors a bioidentical hormone, then that molecule shows up. It looks identical to the molecule it's used to seeing, and therefore it knows exactly what to do with it. So it behaves appropriately. So this is important for progesterone, for testosterone, and for estradiol. And this is why it can be done very safely. Let's talk about progesterone first. For many, many women in perimenopause, just adding in progesterone can be an absolute game changer. It can significantly improve sleep. This is because progesterone is taken by capsules, you take them at night, And once they bypass through your liver, the byproduct of them, or the metabolite, almost behaves like a sleeping pill. It has just kind of a lower anxiety, peaceful, drowsy effect to it, and can significantly improve sleep. Many women claim best sleep. Because it has that effect, it also can reduce anxiety. Some people actually call progesterone the happy hormone. What else does progesterone do if that's not enough? I mean, who wants a better mood and better sleep, right? But let's keep going. Progesterone can significantly improve or ease the PMS symptoms that you may be experiencing, meaning the premenstrual symptoms, the change in mood, maybe you're angry, maybe you don't like your spouse or anyone else that lives in your house. Those symptoms can significantly improve with progesterone on board. In addition, if your abdominal cramping has gotten severe through these perimenopause years, it can make that better. If the amount of or volume of bleeding that you're having has gotten significantly more, it can alleviate that as well. And we won't leave it out, it can also significantly improve the high sweats that one experiences with perimenopause. So let's talk for a minute about estrogen. There are providers that would say that you should add on some estrogen to treat the symptoms of perimenopause. And they will often do this in the form of birth control. It has been my experience that this can turn into a complete disaster. And the reason for that is that, as we mentioned, your hormone levels are going all over the place. They're fluctuating from week to week, month to month. They're high, they're low. And so if we think about giving you estrogen and raising your estrogen levels, well, then what happens if you have a spike of estrogen? Well, now your estrogen levels are probably getting too high, which can actually make you quite symptomatic. Bloating, breast tenderness, increase in vaginal bleeding. So it has been my experience that trying to time or add in estrogen when your own estrogen levels are going all over the place is a bad idea. And progesterone can largely alleviate the symptoms that we're trying to mitigate anyway. Now, that being said, after you would transition into menopause, meaning no longer having menstrual cycles, there is 100% a role for estradiol. But let's save it for menopause. Let's handle perimenopausal symptoms with progesterone and the other hormones. So let's talk a little bit about testosterone. First thing I'll say, and I'll go into this in a lot more detail in a future episode, but testosterone is incredibly important for women. In fact, and you may not know this, you actually have more testosterone circulating in your body than you do estrogen. Yes, it's very important. So this idea that testosterone for the guys, estrogen for the girls, it's a lot more complicated than that. Testosterone tends to be the hormone that oftentimes will begin to wane and lower in levels during perimenopause for women. Now, what does this lead to? Well, it leads to the fatigue that you experience. It leads to the drop in libido, less motivation, part of the reason for the changes in mood. And so optimizing or replacing testosterone can be a game changer for women in perimenopause because it increases their energy. It brings their libido back. Now they're more motivated to go exercise or go after the hobbies that they like to do or perform better at work or whatever the case may be for them. And it can oftentimes also play a role in the mood changes of perimenopause, meaning improving anxiety, improving depression, and that sort of thing. So for women, testosterone can be a player in the solution for these perimenopausal symptoms. It can be given safely and it can be given effectively without significant side effects when done properly by a hormone. So progesterone for sure. Testosterone oftentimes beneficial depending on blood levels and symptoms and those types of things. Estradiol, not for perimenopause, it's for later in menopause. One other hormone that I would mention briefly, and again, it deserves episode or episodes all to itself, is thyroid. Oftentimes, women in particular are quite symptomatic when their thyroid levels go low. And this can be further exacerbated in the perimenopausal years. They're now in their 30s and 40s. The thyroid gland may be not performing as robustly as it was, just like these other hormones are not as robust as they were. And symptoms of hypothyroid can slip in. Again, some crossover with testosterone, fatigue, that sort of thing. Metabolism slows. That's part of the weight gain that we see. There can be changes in hair, nails, and skin, all those sorts of things. And so for my patients in my clinic that come in 30s, 40s, perimenopausal symptoms, thyroid is something that we look very, very closely at because oftentimes optimizing thyroid hormone levels can be a piece of the puzzle for improving their symptoms and quality. One other thing I would say about safety, just to address it, because it is important and it is talked about a lot, and there's a lot of misinformation out there about, why won't my doctor give me hormones, or why won't my gynecologist give me hormones? Well, particularly for estradiol and progesterone, a lot of the fear comes from a very large study released in the early 2000s called the Women's Health Initiative Study, formed late 90s, published early 2000s. Now, over the last 20 years, this study has been largely debunked. It was very poorly designed, and it was even more poorly interpreted. And the real issue with this study is that the authors of the study went into the study when they designed it, and they had a bias. They thought hormones were being overprescribed. They thought hormones were bad, and they set out to prove it, and they did. Well, at least in what they released to the public about what the study showed, says that they weren't dangerous, or said that they were dangerous. I apologize. The reality is, again, poorly designed, poorly interpreted. And now that we've gone back and dug through that study and looking at the mountain of literature that has been done since that study, hormones aren't dangerous. In fact, they're quite protective against many of the things that they said that they were causing. To add to that, in that study, and we will go through this line by line on a future episode, they were studying synthetic hormones. They were studying Premarin, which is conjugated equine estrogen, and they were studying medroxyprogesterone, which is a progestin or a synthetic progesterone. They were not studying bioidentical estradiol or micronized progesterone in that study. And that's a very, very important distinction. So if you want to know why your primary care or your gynecologist may be hesitant, that's why. I would encourage you to try to speak to them about this. Have you looked at the recent literature on these topics? Have you seen where that study didn't prove what they said it proved? Can we have the conversation? Can we consider hormone therapy for me? And I would tell you that if they say no, if it's just a hard stop, I think it's very reasonable to say, you know what, I think I need to find a different provider that will be more open-minded and willing to help me alleviate the symptoms that I'm going through and the goals that I have for my overall. So a couple more things before we wrap up. One is, you may ask, well, is there anything other than hormones? Is hormone the only answer? Are there any non-drug or non-pharmaceutical options to help with perimenopause? And the answer to that is yes. Nutrition is important. Blood sugar stability is crucial during these years. So you want a diet that is focused on protein, healthy fats, fiber, and reduced in the amount of processed carbs and processed foods that you're eating. Because in general, these types of processed carbs and foods aren't great for us. But when you're in these years where the hormones are beginning to fluctuate, your ability to tolerate those processed foods becomes less. So a clean, whole food diet, super important. You also want to consider alcohol. Oftentimes in perimenopause, drinking alcohol is not your friend. I'm not saying that you need to become abstinent. I'm just saying you need to take it into consideration and think about, when I have some drinks, how does that affect me? Do I feel better on the days or nights that I don't drink than the days or nights that I do drink? And then make your decisions accordingly for what you feel is best for you. Exercise. So resistance training, super important. Why is resistance training so important? Well, we know that strength training helps our brain. It helps our mood. It improves our metabolism, as well as improving insulin sensitivity, which I just mentioned can become an issue as the hormones begin to fluctuate during these years. The third one I would mention would be sleep hygiene. Now, we said sleep can be significantly disrupted in perimenopause. So doing the things that we can control by improving sleep hygiene are important. So sleeping in a dark room, a cool room, super important. Reducing your screen time, maybe adding in supplements like magnesium or melatonin to help with sleep are all reasonable things to try to help out during this season. And that would lead to the last thing I would say is that there are supplements that can move the needle on this. Magnesium, important. Ashwagandha can help with cortisol levels as well as lowering stress and improving sleep in some studies. So that's one to consider for sure. Omega-3 fatty acids are also important as well. And then a B complex vitamin, particularly B12, can play a role in energy. Lastly, there are what we can refer to as mind-body tools. So this is things like meditation or breath work or acupuncture. Again, the woman that is in perimenopause has a body that's under stress. And so ways that we can mitigate that stress or address that stress can be beneficial. And each of those that I mentioned can be helpful in that area. So here's the deal. Perimenopause can start early. It can last a long time. And its symptoms are wildly variable. And it has a negative effect on the quality of life of millions of women. And it is caused because hormones are significantly out of balance. They fluctuate high and fluctuate low, and then it results in all the symptoms that we've been talking about today. There are non-pharmaceutical ways to address this, as we just went through. But if we think about it, it's a hormone problem. And oftentimes, particularly for women that are quite symptomatic, it is hormones that are going to be the answer and going to give you the energy and the clarity and the mood that you're looking for. It's going to give you the quality of life that you seek. And again, there is a very safe and effective way to go about this. So the last things I would say, if you're in your 30s and 40s, maybe you're 50, and you're noticing these symptoms, it's worth asking the question, could this be perimenopause? Because if it is, then it can be safely and effectively addressed. And I would say, I wouldn't wait till you're completely miserable. I would actually say that if you're in your 20s and you know this next decade is coming, I would already be thinking about how am I going to go about addressing this? Maybe go ahead and ask your doctor, your gynecologist, hey, when this happens to me, how are you going to address it? Meaning, when you start having the symptoms, start having the problem, to have the solution already sort of in place and knowing that where you're going to go and how that's going to play out can be beneficial rather than scrambling when you're already in this state of misery. So don't wait too long. It's never too early to start thinking about it, at least. And certainly I would not wait till your symptoms are severe before you decide to do anything. And again, I do not think this is part of life. Just write it out is an acceptable answer. And so I would encourage you not to settle for that answer. Don't settle for it's just stress or it's just life or here's a birth control pill or here's an antidepressant. There are more effective therapies for that than that. The most effective therapies that are safe and personalized and effective are probably going to be brought to you by a hormone expert because they study this, they know this, and they treat patients every single day like this. So if this resonated with you, if I described you, leave a comment, ask a question. If there's anything that I can do to help you through this, I want to educate, I want to empower you because as I've said throughout this podcast, it doesn't have to be this way. You're not crazy, you're not alone, and you have every right to seek out therapies and strategies that improve your quality of life so that you get all out of it that you want and deserve. Thank you for listening. I love that you're here, and I'll talk to you next week. Let's live life optimized.
Thank you for tuning into this episode of Holmes on Health. If you found today's episode valuable, share it with someone you care about. And hit subscribe so you never miss a future episode. Want to get more of our content? Follow me on Instagram and YouTube at Alan J. Holmes MD. Until next time, here's to living life optimized. This podcast is for general informational purposes only and does not constitute the practice of medicine or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have, and should seek the assistance of their healthcare professionals for any such conditions.